So what actually happens when you combine the clinical precision of modern medicine with the holistic preventative power of evidence-based complementary care? Well, it's a completely fascinating question. And honestly, the answer changes how we view our entire well-being. We're no longer just looking at ways to wait around and treat illness once it happens. Instead, we're talking about a comprehensive blueprint for architecting your total health.
Welcome to this explainer. Today, we're exploring a truly revolutionary approach called the Rajiv Gupta Integrated Healthcare Model. This isn't about, choosing between modern science and holistic wellness. It's about how to safely, practically, and systematically deliver both to absolutely maximize human health. It's a highly structured model that completely reimagines what it means to be a patient.
Okay, let's dive into this. Here is our blueprint for today. We'll start with the foundation of health, then move to anticipatory medicine, explore the multidisciplinary ecosystem, examine evidence-informed therapy selection, and finally bring it all together with the integrated patient journey.
All right, Section 1, the foundation of health. This is where the rubber meets the road and practical delivery actually begins.
For decades, it's basically been react, react, react. You wait until isolated symptoms pop up, you go for an episodic hospital checkup, and you get treated. But successful integrated medicine, it requires systematic organization, not just kind of randomly sprinkling in complementary therapies. In this integrated model, every single patient has to first undergo a really comprehensive, conventional medical assessment. We have to establish that biomedical diagnoses, figure out disease severity, review medications, and rule out any major red flags requiring urgent help first. You literally cannot build a stable house on a shaky foundation, and you definitely cannot safely integrate therapies without rigorous medical diagnostics leading the way.
Once we've got that biomedical diagnosis dialed in, the clinical team performs an expanded whole-person assessment. We're tracking some very specific markers here. We've got cardiometabolic data like blood pressure and BMI, physical tests like pulmonary function, but we're also measuring psychological well-being. How's your sleep quality? What are your stress levels? Do you have social support? By capturing this massive, holistic dataset, the care team can tailor interventions exactly to what you need, setting realistic goals and giving us a crystal clear way to track progress.
With that massive foundation set, we move to the second part of our blueprint, Section 2, Anticipatory Medicine.
Look, getting sick rarely just happens overnight, right? It's a slow burn. It might start with elevated stress and a few weeks of terrible sleep. Left unchecked, months later, you might see rising inflammatory cytokines or weird arrhythmias. Give it a few years, and this leads to early metabolic deterioration, which finally culminates in a severe acute clinical disease. The integrated model uses continuous AI-driven monitoring of those baseline markers we just talked about to spot these tiny shifts right at the beginning. We can actually catch the precursors to chronic disease way before they turn into emergency hospital admissions.
So who exactly is watching all this data and building out your health architecture? That brings us to Section 3, the multidisciplinary ecosystem.
Practical integrated medicine relies heavily on collaboration. You, the patient, sit right at the center of this ecosystem. Instead of bouncing between a bunch of different specialists who never talk to each other, this model completely tears down those fragmented silos. It creates coordinated pathways where everybody shares one single electronic health record. This interconnected web acts like the air traffic control for your total well-being.
Let's break down who is actually on this team. The physician is the captain, responsible for the diagnosis, medical treatment, and overall coordination. Nurses are so crucial here for education, behavioral coaching, and making sure treatments are working. Then you have the pharmacist, and their role is huge in an integrated model. They review safety, hunt for potential herb-drug interactions, and even find safe ways to de-prescribe medications when appropriate. Dietitians handle the evidence-based nutrition side, and complementary practitioners like yoga therapists or acupuncturists bring incredible value, but always within strictly defined scopes of practice. This coordinated team approach means nothing falls through the cracks.
Now that we have our team and our baseline, how do we choose the right therapies? Let's hit Section 4, Evidence-Informed Therapy Selection.
This is an absolute deal-breaker for this model. Not all complementary therapies have the same level of scientific support. Evidence-informed selection means we only integrate therapies as structured adjuncts if they have real hard scientific evidence behind them, like systematic reviews or high-quality trials. They are never, ever used as unproven replacements for your essential conventional treatments. If a therapy lacks adequate evidence or presents unacceptable risks, it's out. The days of opportunistic, Wild West alternative medicine are completely over. Think of this structured selection like a tiered pyramid. Look at the base. Modern medicine is the bedrock. It's rigorous, it's essential, and it's non-negotiable. Only once that base is fully secure do we move up to Tier 1, which includes broad, evidence-informed complementary components. Think structured yoga, cognitive behavioral therapy, or nutritional programs. And finally, at the top, Tier 2 holds highly targeted complementary interventions, like acupuncture for specific pain, all governed by super strict interaction rules. This translates into a highly disciplined clinical application in the real world. Step 1 is always modern medicine first. Step 2 is adding those Tier 1 interventions, the low-risk, high-benefit foundational components. Step 3, if things aren't fully resolving, is escalating to Tier 2 targeted therapies. And Step 4 is critical, applying stop rules. Basically, if a therapy isn't working, or if new research shows it's unsafe, you stop. The care plan modifies as new evidence comes out. It's totally transparent.
To give you a really concrete example of a Tier 2 intervention, let's talk about curcumin. We're not just grabbing arbitrary supplements off a shelf here. When the evidence actually suggests a benefit and safety is locked in, selected herbal preparations like curcumin can be used as a scientifically supported add-on therapy for conditions like osteoarthritis or inflammatory bowel disease. But, and this is a major but, it is used alongside established treatment, and potential interactions with your prescribed medicines are carefully reviewed by that pharmacist and the whole multidisciplinary team.
And consider how this builds when we use a Tier 1 intervention like yoga. We aren't just talking about stretching and feeling relaxed, we are talking about physiological alteration. Structured yoga programs literally rebalance the body's inflammatory system. It physically lowers biomarkers like C-reactive protein, interleukin-6, and cortisol, while boosting your antioxidant defenses. We are using these practices to actually rewrite the biological environment that allows chronic disease to thrive in the first place.
So, what does this actually look like for you? Let's bring it all home with Section 5, the integrated patient journey.
We've seen today that successful integrated medicine isn't about randomly throwing supplements at a problem. It requires systematic organization, incredibly thorough baseline assessments, collaborative teams, and strict adherence to evidence-based science. The resulting care plan seamlessly blends medical treatment with lifestyle tweaks, psychological support, and targeted therapies customized entirely for you. So I'll leave you with this to think about. In your own healthcare journey, are you just waiting around playing whack-a-mole with isolated symptoms? Or are you going to demand the systematic, evidence-informed care required to architect your total health? The blueprint is out there. It's time we start building.